Hi all. Someone recently shared that while on a course of antibiotics to treat a small intestinal bacterial overgrowth, often simply referred to as SIBO, they felt worse than ever. And it was a surprise, a very unhappy and unpleasant surprise. There is a reaction to antimicrobial treatment referred to as the Jarisch-Herxheimer reaction, also known as the Herxheimer reaction, or simply Herx, or die-off response. This condition is named after two dermatologists that worked in the late 1800s and early 1900s, and they both worked with people that had syphilis. And syphilis is a disease based on a spirochetal infection, meaning that it's a spirochete type bacterial infection. For this video's purposes, what defines them is they have a corkscrew curl sort of shape to them. So while originally the Jarisch-Herxheimer response refers to spirochetal infections specifically, the term is utilized now for a wide range of microbial infection types, including small intestinal bacterial overgrowth. And so what they found in both of their practices is that when they would treat someone with syphilis that had the condition of skin lesions, their symptoms of those skin lesions would worsen at the beginning of treatment, given treatments back then were quite different than now. But what happened was those symptoms got much worse before they got better. And so people who are being treated for SIBO and go on antimicrobials that are either allopathic antibiotics or perhaps more herbal-based antimicrobials could experience this worsening of their overall symptoms. Often people will complain of flu-like symptoms, so headache and achiness and listlessness and just that general feeling of malaise, but also brain fog, even fever or rashing. The main thing about the Herxheimer reaction is that the bacteria is dying off faster than the body can clean up its inflammatory byproducts. So many practitioners will use a low and slow protocol process, meaning not jumping into a full dose at one time of whatever antimicrobial it is. Some practitioners agree that if these Herxheimer symptoms are lasting beyond 5 to 7 days, that maybe the body needs more support with their treatment. Some of those interventions might be supplemental binders. They're an oral binder like activated charcoal, clay, pectins, different brands with different kinds of complexes. Something that's important to keep in mind, however, is looking out for symptoms that are an adverse reaction, like an allergic reaction or even possibly sepsis. So that symptom set might look more like high fever, abdominal pain, hives and rashing all over, swelling, especially lips and tongue, throat, difficulty breathing. Those are all potentially more serious symptoms that could indicate an underlying issue that needs urgent care. Herxheimer symptoms can be pretty miserable, and unfortunately some practitioners don't give their patients or clients a heads up that this is a possible reaction to antimicrobial use. I just hope that this list is bringing someone comfort somewhere, and I encourage you to speak with your practitioners and see what other supports you can have if you're having a severe Herxheimer response or an extended Herxheimer response.